Thank you so much, Suzanne, and thank you so much for the Center for Community Health Equity and the DePaul MPH program, and for all of you today in your coming to attend our presentation in the closing plenary session. I hope you had a chance to stretch, and I hope that we can give you a really good story about what I think is one of the most, for me, one of the most special parts so far of my work in public health. First and foremost, I'm a practitioner. I worked at the Cook County Department of Public Health for about 28 years, and before then at the Lake County, Illinois Health Department, and before then at the Los Angeles County Department of Public Health in California. So I am retired. I teach one class at UIC. Shortly after my retirement, I retired in October of 2020. In February of 2021, I read an article in the Guardian US, and it talked about these hunger strikers on the southeast side of Chicago, and I immediately got interested, and I thought, oh my God, it's so bad that I didn't know this was happening. So as it turns out, the struggle was happening for 3 years, and what I'm going to tell you about my story and our health community's involvement with this is as latecomers in a community-led struggle that had been going on for about 3 years prior. Let me also not neglect to thank you, many of you who signed our petitions, who participated in our solidarity from the health community, which ultimately led to a victory, and that's why we call this session Permit Denied. So I really want to recognize you. Also, folks who are leading the struggle, who are leaders, I'm so happy to have them here. I'm honored. I am very happy that they lent their trust during COVID, and actually this is the first time we've met before in person. So much of the work that we did was based on relationships of trust and networks. So that was very special. I just want to mention that Oscar Sanchez is a resident of Chicago's Southeast Side. Oscar co-founded the Southeast Youth Alliance, Southeast Response Collective. He's a member of Chicago's Democratic Socialists of America, previously served on the South Side Steering Committee, and member of United Working Families. He currently works as the Southeast Environmental Task Force's Community Planning Manager. Is that right, or did you just transition, Oscar? Okay, thank you.
So before I worked for Alliance of the Southeast as Director for Youth and Restorative Justice Programming. In February of this year, I transitioned to be working for the Southeast Environmental Task Force. So yes.
Thank you. And Beria Hampton, it works for the People for Community Recovery, which is an organization that I was familiar with through working with Cheryl Johnson around 2012. But People for Community Recovery, or PCR, has just a storied, long-time history working in Altgeld Gardens to fight toxics and coin the term the toxic donut. And the director, Cheryl Johnson. Now, Cheryl is the daughter of the mother of environmental justice, Hazel Johnson. Correct. And so I really appreciate Beria's participation today. Thank you so much, Beria, for coming. I just want to recognize that we live and work in a land of the Peoria, Kickapoo, and Potawatomi nations. These lands were traditional territory of these native nations prior to the people's forced removal. They continue to carry the stories of their struggles for survival and identity today on these and other lands. And I want to point out that Principle 11 of the Principles of Environmental Justice are that environmental justice must recognize a special legal and natural relationship of Native peoples to the U.S. government through treaties, agreements, compacts, and covenants affirming sovereignty and self-determination. This is what we're going to be talking about today, and Permit Denied. And I think this, I wanted to bring up the difficult and, to me, very troubling, what I consider complicity of governmental public health with environmental racism. And we'll talk about that a little bit more. But you'll see up in the upper left photos of the hunger strikers who were on hunger strike for 30 days. Oscar was a hunger striker. In the middle, I think I wanted to represent the fact that this victory was won through action on the streets and mobilizing people, pressuring, making the political will that our keynote speaker this morning referred to. Dr. Griffith said that structural change would not happen without the political will, and that depends on the context and having that political will. So this was an issue of power building, and the stories about that we'll try to get across well. Also, that on the upper right is the representing work that involved communicating data, pressure, allowing the public opinion to be changed and expressed through public letter writing and petitions. And there were several of those. They were very effective, but there was also a lot of work on social media. I also want to recognize that Cook County has a leadership team. I'm just one of those folks. We're a volunteer organization. We don't have paid staff. Other leaders are Danny Block, Jonathan Contreras, Wesley Epplin, Patricia Fron, Felipe Tendick-Matesanz, Booker Marshall, Linda Ray Murray, Alicia Riley, Brenda Rodriguez, Joanna Tess, and Griselle Torres. So here, what we'll see is that I was ecstatic. I don't think any of us expected that we would win this victory. And that's why it's so exciting to talk about. So in addition to the troubling nature I talk about with governmental public health, which my whole career was in local county governmental public health, this is an exciting victory, and I think there's many insights and lessons we can learn. I'm really hoping that we'll have a lot of time to talk about it from community leaders' perspective of building people power, because community members led the way on the front lines. I also want to mention that I have a quote from Malcolm X, which says that if you stick a knife in my back 9 inches and pull it out 6 inches, there's no progress. If you pull it all the way out, that's not progress. Progress is healing the wound that the blow made. And if they haven't even pulled the knife out, much less heal the wound, they won't even admit the knife is there. So I think it's appropriate given the Malcolm X College hosting this. And also I want to mention a quote from Stephen Whitman. We have to regard this problem as if it was a problem in our family, and we have to fight like hell to change it. So I think that those two quotes kind of bring up some of the issues of struggle, of power building, and the fact that to this date, we have horrendous, preventive, and shocking differences in health status by population because of racism and classism and other forms of oppression. And I think what is only one indicator of that is the huge drop in life expectancy for black and brown people in Chicago, which has made it even worse than it was before. I'm just going to go really quickly. This is a leadership framework, which I really like, from Begin and Malcolm. And one of the main things it talks about is building power and what leadership is. And I think it's unique, and I think those of you who are interested in public health would like this book by Begin and Malcolm from 2014. And it says that many different individuals mobilize others to address public health challenges. The leader role is not reserved to those with position power in organizations, programs, and communities. People can lead by role modeling the changes they support. Several forces will continue to limit the influence of public health leaders. First is the role of private corporations in the political systems of government, particularly in the United States. Private corporations lobby for policies that often conflict with the public health approach. So I'd like to just run through some photos that I think exemplify pieces of the campaign that at least I was involved with. Again, as a latecomer, this is a protest in the street near where Mayor Lori Lightfoot lives. I believe that was in Logan Square. It was a really stimulating, exciting moment, I would say, for me, because I felt powerful. I felt that people were collectively demonstrating against racial, environmental injustice, in their neighborhood, and it was clear that the mayor was a person who had agency, who had duty and responsibility to all the citizens of Chicago. And so that was a powerful moment. This is at a church, I think before that March, again, March 4th, outside of Mayor Lightfoot's house. Another one in the same demonstration. And I want to point out the Health and Medicine Policy Research Group, along with Collaborative for Health Equity Cook County, kind of spearheaded, I think, mobilizing a public health voice in solidarity with the demands of the frontline organizers. And I just recently added this to make clear my feeling that this was in opposition to the city of Chicago and its public health department. And I think that's one of the things that is most troubling for me, and I still wrestle with that question. How could the Chicago Department of Public Health's leader, Dr. Allison Arwady, kind of turn things on its head? And actually, often we talk about, how can we do good community engagement? And instead, community members found themselves in opposition to their public official charged with protecting everybody's health. Despite a commitment about racism as a public health crisis, and it's very troubling. I want to mention that Cheryl Johnson is really, I admire her so much, and that she's done a lot of work on food justice, and I had the great opportunity to interview her, and there's a short video up here about food deserts. Hazel Johnson is a picture here. She is, again, the mother of environmental justice movement, and I think it was about a year ago we celebrated the 40th anniversary of the first People of Color Leadership Summit for Environmental Justice, which is a turning point in environmental justice organizing and history in the United States. And I just want to mention, I tweeted it, there's a free discussion about Hazel Johnson in tribute to her at a publishing event that's coming up September 10th. It's on Eventbrite. And I would ask Beria to fill in the blanks about the things that I'm not able to describe well about Hazel. This is a picture of the First National People of Color Environmental Leadership Summit. Again, it took place in 1991. People from all over the country and from all over the world. My mentor, friend, and colleague, Dr. Linda Ray Murray, is in that second photo from the left. And this really was a turning point. I just pulled out these 3 principles of environmental justice that they affirm the fundamental right to political, economic, cultural, and environmental self-determination of all peoples, that people have the right to be equal partners at every level of decision-making, and that it considers governmental acts of environmental injustice to be a violation of international law, Universal Declaration of Human Rights, and the United Nations Convention on Genocide. The complete list of 17 is in an appendix, and if you get these slides, which we'll make available, you'll see that entire list. This is about Cook County. We're interested in building power for health equity. We're interested in struggling for policy changes to tackle root causes of health inequities, and we want to develop a community of public health voices against racism for social justice. This was our first letter, which was signed by over 70 organizations and over 500 individuals. Again, at about 3 years into the struggle, and this was an open letter to Mayor Lightfoot and Commissioner Arwady. We said that we demand that CDPH follow its own community health improvement plan, Healthy Chicago 2025, which, as I looked at it, has Cook County as a participant in that plan. And I'm like, that's interesting. I don't remember that, but this was terrible. We never would have been interested in violating and turning on its head the plan that we participated in, but prioritizing environmental justice, racial equity, and health equity in its actions. I couldn't believe that they denied and overruled and ignored their own data. So this is from the Air Quality and Health Index of 2020. The star on the upper right in the green is in the best decile for health and air quality, and they were moving that from Lincoln Park to the area that has the most riskiest, most polluted air in the city in the red, and that's on the Calumet River there. And their own report says that neighborhoods need to be prioritized for efforts to mitigate and reduce air pollution. Their Healthy 2025 plan, you see this circled in red. Environment, everyone should have the right to breathe clean air free of harmful pollutants. And with a focus on communities disproportionately burdened by pollution, about closing our life expectancy gap. A slide that I left out reported on 3 cities in the United States and showed that air pollution and other kinds of issues around social vulnerability, so-called, was connected and related to higher COVID mortality rates. So as we work to lower the life expectancy gap, or we say we are, and as we work on to have equity in COVID mortality and morbidity, apparently we're not able to apply or stand up for applying issues around air quality. The health department isn't. There was a March 9th press conference, and this video is available on the Health and Medicine Policy Research Group around the letter, and a number of leaders spoke at that one. We had media coverage from this big letter, again, which many of you signed, and you can see those here. This was Crane's Chicago Business op-ed, authored by Wesley Epplin, Olga Bautista, and Dr. Linda Ray Murray, which said in part that Chicago officials should fight against the racist structuring of health risks rather than participating in its creation. We got a response back from Commissioner Arwady. So she says, thank you for your input that you've provided and for invoking Healthy Chicago 2025 to ensure that CDPH and the city are accountable to our health and racial equity commitments. At the same time, we recognize that the issues at play here are much larger than a single facility or even a community. And as I reread this again yesterday, I really tried to wrap my head about what she was trying to say. I'm not sure, except to me when somebody says at the same time, there's almost like a contrast or a juxtaposition. And I just frankly think it's troublesome. So we responded back. This time only 5 of us. And we said, you're obfuscating your current responsibility and authority. You can't just look at future actions and say, oh yeah, well, it's just one community, or in the future we'll do better. I'm not sure, maybe that's what she wasn't saying. Your response that says the Southeast Side is a vulnerable community was not what we said in our first letter, because the city itself has for decades made and allowed structurally racist decisions to concentrate pollution and other health risks in communities of color, including the Southeast Side, as one such concentration of pollution. I cannot underline enough the importance of the public letter from the University of Illinois School of Public Health to Mayor Lightfoot and Dr. Arwady and other officials. I want to recognize that Daisy Magana, Victoria Persky, Jenny Hebert-Byrne, Sarah Erdahl, and the UIC Dean of School of Public Health, Wayne Giles, organized and drafted this letter. It was unique, it was special, and I think, it emphasized the amount of rejection of this blatant example of structural racism and environmental racism. So that was January 6, 2022. I think in the interest of time, I may end after this slide, because if we look at history, one of the things that also is troubling to me is that at least some of the most recent roots of the general iron struggle and this attempt to worsen environmental racism has its past is connected to Rahm Emanuel and also former commissioner of CDPH, Julie Morita. There were 2 publicly minded scientists from UIC who were doing air quality research, and Rahm Emanuel was very concerned about this, and so he had his deputy email back and forth, and these emails were FOIA'd and published in the Tribune. And one of them quotes Dr. Morita saying, "The researcher is very connected to the environmental advocacy groups and is not someone I can reason with. You may need to engage with the chancellor if you want this to be stopped." So that was a May 2nd, 2018 email. So I'm going to end here because I'd like to stop and hear from the leaders who have been working on this for longer than we have. And but again, I found that this wasn't even a neutral stance, and it was very troubling to have a commissioner of a local public health department in the city of Chicago working behind the scenes to stop data, to pressure scientists from a public university like UIC School of Public Health. So I think it adds emphasis to the courage that even folks in a university system need to have to stand by their ethics for justice, for truth, and for a democratic process. And I think it's really unfortunate, to say the least, that there could be a possibility that a public health department director would take orders from a mayor who had clear interests in terms of political contributions from the owners of General Iron in Lincoln Park, when that facility, that recycling metal shredding facility, already had a horrendous history of environmental violations. So I'd like to turn it over to Beria, please.
Hey, how y'all doing? Sorry for earlier. My name is Beria Hampton. I'm a resident of Allgill Gardens. If you're not familiar with that, that's located on the far south side on 130th Street. Okay. Again, like I was saying, I'm a resident from Allgill Gardens, a place located on the far south side of Chicago, on 130th, a place a lot of people don't know about, pretty much a blighted place. I work for the organization People for Community Recovery. I'm working right now with the executive director, Cheryl. But let me give you a little info about how this whole thing started. So People for Community Recovery, PCR for short, it was founded by the late Hazel M. Johnson in 1979. She fully incorporated and formally legalized that organization in 1982 to be a grassroots not-for-profit organization. Ms. Hazel Johnson, internationally known as the mother of environmental justice, was one of the first organizers to draw the connections between socioeconomics, public health, and environmental equities in low-income communities of color, Blacks, and Hispanics. Through Hazel's reign, she stopped more landfills from polluting the Chicago communities. She also had fought for the removal of asbestos in our public housing, because in our public housing, a lot of the tile had asbestos and the lead was in the paint on the walls, and it was making people sick and things like that. But what drew her to realize that was the passing of her husband. Now, her husband was a light smoker, so she, knowing that it couldn't come from cancer, and then watching a community of people just steady suffering different health ailments like asthma. I'm one who had eczema. My brother had bronchitis, and we all believed, and just like Hazel, that this is coming from the area in which we live in. No way that she can really prove it because she wasn't a medical expert, but her intuition led her to believe that it's a problem within the community. So Hazel, with her strong belief, losing her husband, being a mother of 7 children to raise because her husband is gone, and also she's a resident in Allgill Gardens from that time that I've known her, because I got there in like 1985. She was already there. So I've been knowing her since I was 7 years old. I actually stayed on the back. So I'm a resident of Allgill from 1985 until this current day. So I have a lot of history with them, even from young on. And young on, I did not know a lot of stuff that Hazel was talking about, but now I can appreciate her today for a lot of reasons. Okay, she prevented hundreds of affordable housing units from being demolished when people were homeless and needed somewhere to stay, right? She stopped that. She helped, she organized to do those things. You don't realize how great of a thing that people really do, because unless you're directly affected by it. And a lot of stuff I wasn't directly affected by just yet, okay? And because of that, our area. She labeled our area the toxic donut because it was surrounded by a lot of industrial landfills, facilities, and polluted waterways, and air quality was very poor in our neighborhood. It almost smelled like death, for, if you even know what that smell like. I don't, but I just can imagine that it's not good, right? With her shedding that light between the industrial pollution and the negative health outcomes in frontline communities like ours, we played in this soil. We played in these streets, never knowing like that this was an injustice. And that's the baddest part, because we're kids and not knowing that it's injustice. And that community that I come from, this is a community that was rich in culture for me. We had a lot of resources at one time when I was a kid, and slowly it started to funnel away. And people like Hazel, fighting just for our justice, just for us to have clean air, clean water. We played in these fire hydrants. We played on these streets, honey. It hurts me to the core to know what we were really playing in and just being simple as kids, right? Another notable thing that Miss Hazel Johnson did, she played a major role in the passing of Executive Order 12898, and that was when President Bill Clinton was in office, which was the very first piece of legislation to address environmental justice in minority and low-income populations, and that was in like February of 1994. Her work still didn't stop. And just from 1994 to 2011, which was a short time, Hazel Johnson passed. So that left I ain't gonna call it the burden, but that left her daughter Cheryl to be responsible for that, because Cheryl knew what her mother's fight was about. It wasn't just about her. It wasn't just about her husband. It was an entire community and other communities around the world. So, just her starting that little thing became national attention. Now, as y'all know, it's climate change, right? She been saying there was something wrong with the air. Thank you, Miss Hayes. Her legacy continues, though, through Cheryl Johnson. I work directly with her. She is so determined to carry out her mother's legacy. I don't think that's the path that she chose, but that's the path that chose her. Okay, and she do it very well. She continues to this day to fight on environmental issues. Cheryl, the impact that she had, from relentlessly fighting, she fought to recruit more than 800 participants for a historic health study to understand those connections between pollution and the health disparities within our neighborhoods, and that affected other neighborhoods as well. Okay? She created a curriculum for dozens, citizen science and air monitoring advocacy within the city of Chicago. Great. And we talking about people who didn't have a clue of what this was going to be. We didn't wake up knowing that we was going to be fighting for the world, our community, no day. We never woke up to be a superhero, but this is what we have to be because of our fight and our plight and people who don't understand. And as we understand, we must educate them. She negotiated also with utility companies to secure a $50 million increase in funding for low-income efficiency and affordability programs. She also educated, organized, and mobilized environmental justice residents just to pass historic state and city equitable energy legislation. She didn't stop there. This Cheryl, y'all. She worked with Illinois Landmark to obtain historical designation for Altgeld Gardens to be a historic district, because this community meant so much to us. Regardless of us being surrounded in all the health disparities and negative outcomes that we have had, we still have to fight for the people that have to come up behind it. And that's where I step in as well, because I agree. And also, by the way, big ups, we got approved under the Department of Interior to be a social historic district in March or April of this year, so that's a good thing, okay? So, also, by us being a historical district, another good thing that we found out is that Altgeld is one of the sites within the historic Pullman district, if you know anything about the Pullman area, how that relates to Altgeld Gardens as well as the Underground Railroad, Cheryl also organized to stop the Chicago Public Schools from demolishing one of our buildings located within Altgeld Gardens, and we've known to that as the C building. This is one of the schools that built in 1944, and it was most of our first schools. that we were able to attend. So the school has not been up in over 20, almost 30 years maybe. Okay, so we're right now, that's what we're working on. Right now is a campaign for the C building, and Cheryl is looking to repurpose that building in honor of her mom, the late Hazel M. Johnson, to become the future home of PCR. And we're gonna refer to it as the Hazel Johnson Environmental Training Center and Museum to display a lot of the environmental justice work that we do, so you guys can learn a lot more about what's going on. Also, you know, we stay in a food desert. We have no grocery stores within close proximity. We have residents that are elders and that are disabled, that does not have direct commute to any grocery stores, pharmaceuticals, or anything like that. So right now, we're organizing to repurpose up top, which was our commercial grocery store before it got closed down, comprising of several stores, so that we can bring food, jobs, and resident-owned businesses into this blight area. And in that commercial strip, that was one of the first offices that PCR had when they first started organizing. Up to this day, you guys, Cheryl continues to educate the residents as well as the public, and advocates and coordinates services on issues of the environment, health, housing, safety, and economic equity. Again, I'm Beria Hampton. I'm a resident of Allgale Gardens for nearly 40 years. I'm passionate, just like they were, about this community. I've been doing community work for most of my life. I am a community leader as well. I've been knowing Hazel since, like I told you guys, 1985. I was 7 years old. A lot of stuff that we did then, I had no knowledge of, just like when we go to church, we don't know what they're talking about. And later on, it clicks. And this was one of them things that clicked. And that's why I'm passionate about it today. Because not only do we suffer health disparities, our educational resources has been tampered with too. I graduated a salutatorian. So that meant I was pretty smart, right? So I got to college, that was the first time I realized I was dumb, or at least felt like I was dumb, because I'm in a campus and I've got people from different areas, and I felt I was failing at first because I couldn't compete. How do you go from somebody with a high victory to a low victory? That's how I realized that our educational curriculum was cut. And I was a victim of that. So I had to go just as hard just to make it. And I went to school for chemical engineering, guys. My mom was a chemist. She worked at the Metropolitan Water District, so I had that support that way. And when my mom died in 2007, I kind of lost it, right? I got it a little bit back with Cheryl, working with her, okay? Environmental justice, what it does for me, it teaches me like a holistic approach of nature, preservation, and social justice, and how to look at the environment as a whole part instead of a piece. It has taught me to be resilient and determined no matter what curves life throw. Because you all know too well, we get told no, and they expect us to walk away. Even if we can't prove that it's right, it's a feeling that we get, and it causes us to go and take other avenues to get there, to get everything understood. I want to talk a little bit about Cheryl being into the General Iron movement, which I know Oscar is going to really populate that story for me. So what I can say about the General Iron, that it was an industry, an $80 million scrap metal facility that was moving from the north side, that got changed because of the zoning laws got changed, and the residents in that community did not want to hear the noise. They did not like the smell, so they had complaints, and they did not want that in their area. The industry, money-driven, not caring about the people, decided to bring that industry to an area that's heavily populated with low-income people, minorities, Hispanic, and Latino people. That's not right. And then we already heavily populated with this pollution in our air quality that's messing up our waterways and stuff like that, and they just wanted to bring it. So that was part of what the big part of the organizers did, and how Cheryl got involved into organizing or assistant organizing with them guys, you know? So Cheryl assisted with the group, the organizing efforts to stop the general iron and adding the more pollution to the heavily infiltrated areas on the south side. You can take action with PCR. Congressman Bobby Rush, the Democratic for Illinois, he introduced federal legislation to honor the work and legacy of Hazel Johnson. Such recognition can help highlight environmental justice struggles that continue to happen across the USA and other parts of the country, and create more opportunities to uphold polluters accountable for their community impacts. You can take action by signing the petition at www.pcrshy.org/Hazel. Also, PCR does toxic tours of the area to help people learn more about the work we do. You can call us at 773-840-4618 or visit the website at info@pcrshy.org and find out how ways that you all can get involved. And thank you, guys.
Oscar? I'll really try not to do that. Can everybody hear me? Yes. I cannot see the far back, so if you're giving me a thumbs up, I cannot see you. I'm very sorry. But before I get started, can we please get another applause to Beria Hampton for being here, please? Thank you. Of course. It's really hard to hear these stories about our communities because right now it's a story. But with these stories, we really have to understand that these are lived experiences from community members. And hearing Beria, I think it's the most saddest part is that we fight so hard for our communities because we love them. We care because it's where our family members are. We care because it's where our friends are. And people are like, why don't you just leave? What if somebody told you to leave your home? That's where we have our roots. That's where we have our joy. And for me, hearing these stories, I haven't talked about my experience in the Stop General Iron campaign publicly in about a year. And of course, we have really good news today to be able to celebrate, but a lot of emotions are going through me having to relive what it's like asking for help in these campaigns. So I'm going to say again, with the Ask Beria, if we can please have that link sent out to folks and have a petition, it would really make a lot of difference. Because again, I think one of the messages that I'm going to bring today is that when people come together, we can really make a difference. And I wholeheartedly believe that because I put my life on the line because I think we deserve better. I don't think, I believe. It is our birthright to thrive. When you are born, every single person being a healthcare professional here can say, when you're born, you're meant to grow. And how can I grow if my space is limited or if my space is contaminated? It is our birthright to thrive. And I need every single person going into this profession, being able to look at your clients or patients or people you're looking after to understand they are meant to thrive. And how am I ensuring they're going to thrive? I haven't even really started my presentation yet, I'm sorry. So I'll start now. My name is Oscar Sanchez. I go by he, him, el pronouns. I may say jokes here and there. If you laugh, it'll help my self-esteem. And if you don't, I rather you leave, please. And I just, did you hear? We're the last presentation, so we got pretty high expectations. Did you know that?
Did I do a good job,
Yeah,
guys? Because I was nervous every step of the way.
I'll say this to you like I always tell, nobody, you are an expert at your story. Nobody can take that away from you. You know, I love you as well.
Love you too.
So right now, really quick, I want folks to close their eyes. And please I'm not going to make you meditate. I'm going to close your eyes. And I want you to visualize when you first heard about this pandemic, when you first heard there's a quarantine, I want you to think about frantic calls, saying, are you okay? What's going on? What's the worry? I want you to visualize kind of that panic, right? For my community here in the Southeast side, you can open your eyes. That was what happened. We looked at each other through a Zoom call because we were like, first of all, how do we get everybody? You can't get 16 people on a phone call anymore. It's very different. So we already went on Zoom, and I think that's the most traumatizing experiences. I was 22 at that time, and I heard community members, I heard mothers, fathers crying, saying, what are we going to do? I was 22, I'm 25 now, I was 22. But that's the type of atmosphere we're in. Nobody knew what to do. The people we looked up to, they were lost. And for me, my background is always, I was raised by a single mother, so my background was, community, food pantries. And then my mom remarried, and I had a father, and they worked day in, day out, night shifts. Nobody took care of us. Community took care of us. My mom would arrange with community members, hey, can you take care of my little Oscarin? Is that cool with you? And they would be like, yeah, sure, why not? But in all seriousness, community for me is everything. Because without community, I wouldn't be here. Without community, my mom wouldn't have a support system. An immigrant from Mexico wanting to have a life for her children here in America, it's not an easy thing to be able to say, right? The jobs in Mexico are very different. My grandfather lost one of his arms and part of his hand due to industry. And because of that, my mom had to work as a young woman at the age of elementary to support her family. My mom was the oldest and had to work because of the injuries and the harm of industry. But fast forwarding to this pandemic, it's different, and I think we have to acknowledge we lost many people in this, and it's one of the most saddest parts, but we're always reminded, what do we have to do to survive? And I think that's that key word. I want folks to reflect, what does it mean to survive? What is safety? What does it mean to live? And what does it even mean to exist? But wanting to move the subject forward, what we did then in that question, when everybody's asking, what do we do? Community members said, we're going to take care of each other. I got off mute. I was shaking. I was like, we're going to take care of each other. And that's all we could do. So we're like, okay, who's gonna provide information? Okay, we have some healthcare workers here. Who can contact them? We arranged some meetings. We arranged panels, virtual panels, workshops about how to handle precautions, how to get food. We set up volunteers for this pandemic for food pantries. We did everything we could to take care of the community, and then things stabilized. Right? We were like, okay, we're at a point where we can take a breath, right? And then there was the murder of George Floyd, and we have to be very explicit when we say it was the murder of George Floyd, and it sparked this interest of everybody with social and racial justice. In the Southeast side, my community, I'll say it not proudly, but because we're changing it, it was very racist. Our community was a sundown town. Does anybody know what a sundown town is? Can we get a raise of hands if you know what it is? All right. For those of you who don't know what a sundown town is if you were a person of color going into a community, they would shoot you at night because they would hide your body and you would not be found afterwards. In the 1940s, 50s, on the one of the roads, they had a banner in our community that said, "If you are an N-word, this is a sundown town. You will be shot." That is the Southeast side. But where it is today is people. The Southeast side is full of immigrants and people wanting to have a better life, and this is the context of many areas here in Chicago. But we wanted to say, what does addressing racism look like in the Southeast side? So then youth were saying, how do we uplift this message of Black Lives Matter? So we then, the Southeast Youth Alliance, alongside the mutual aid group that we developed, the Southeast Response Collective, did a march down Commercial Avenue, the largest march ever done, with over 500 individuals coming to say Black Lives Matter. And I think to continue the story, it's about what does that even mean? So we held this, and we had information sessions. We held workshops. Again, all we wanted to do, and what's the most important part, that in any part of participation or any part of community is like, how do we have dialogue? It's not about me talking to you, it's about monologue. It is about how am I having a conversation with you? How are we breaking these stigmas by able to have a conversation and understand our privileges, understand our biases, and be able to say, this is racism. And we have to address the root of these issues. Because a lot of the issues we face today in America and in local communities, like my community, is racism and the effects of capitalism. So we did protests. And I think many people who know me or don't know me, that I was, very involved in this movement. But then there was the question, what does safety look like, or what does racism look like in the history of the Southeast Side? And we look at the industrial corridor, right? We look at the Southeast Side as a dumping ground. And I'm not saying this because it is. I'm saying it is because what the city has used this for. I don't know if many of you know this, but one of the first steel mills in Chicago was by the Chicago River, over here by Grant Park. And then when some rich folks started moving in, they said, we don't like this view. So what they did, they moved that steel mill to the Southeast Side. And the Southeast Side already had steel mills. And it's the same story of General Iron saying, we don't want this facility, we're going to move this facility here to the Southeast Side. But before I get ahead of myself, that's what happened. After we started asking, what is racism here, some of our mentors were like, hey, there's this General Iron coming. It is this recycling company, this metal shredding recycling company that is coming from this predominantly white area, rich area, coming here to the Southeast Side in this black and brown community. And we were all shocked, saying, well, how long have you known about this? And we said, well, 2018. We knew about 2018, it was 2020. And we were scared. And I think that's the question we always ask, who's here to protect us? The same question about police accountability is with the representatives. It's like, who is here to represent us? And that's where Jim talked about this slightly, but I'll say this as we keep going, is when it comes to our Chicago Department of Public Health, when it comes to the mayor, when it comes to all these representatives, your job is to represent our concerns. Your job is to make sure that we feel some type of protection or some type of way that's implemented to make sure we're safe. So we heard about General Iron. We didn't see our alderwoman, our local representative, doing anything about it. So we did a protest. And after that protest, we did more protests. We did marches, but we didn't do them because, we had no alternative. We were doing every single thing possible. We had community town halls that started with 100 people, move all the way to 500 people at the end of December. We had teach-ins. Again, it's always about trying to have a dialogue, because I don't know if you know this, but when things feel so clean, what does it mean like to build power? So that was the point. And I don't know if you all feel this, but when you have 500 people saying you don't want a polluter coming into your community, and then the city of Chicago saying, well, we're going to give it another week for this application. We'll let you know the news after this week. And after that week, they said, we're going to delay this for a while. Folks, we took a breath and we're like, okay, this permit is delayed. And this was in late December of 2020. And a week later, the application was 256 pages. It went from 256 pages to 1,256 pages that the city of Chicago said, we're going to give you 2 weeks to review this application and give commentary on it. I'm not an engineer. I wish I was an engineer some days. I really don't want to. I don't want to think like an engineer. Engineers think very visually. I like thinking the way I think. But it's the way things are is that they're stacked against us. What does it mean to be silenced when you have that kind of application? What does it mean to even have a say in these applications or have commentary when you don't know these languages? So from there, we were desperate. Y'all tell me, we did marches. We went to the mayor's house. We went to the alderwoman's house. We had teach-ins. We had community town halls with up to 500 people. What do you do then? I need you to feel this silence, because that's what we're asking ourselves. We didn't know what to do. And again, it's the same sentiment at the beginning of the pandemic. What do we do? What do we do? Because it's not our job. I love Beria, but it's not our job to be out in the front lines trying to take care of our community. It is not our job. It is not our job to risk our health. People from the communities that have the highest rates of respiratory issues are the ones at a pandemic trying to make sure food pantries are staying active and alive. Whose job is that? Right? So when you hear these stories, it's the stories of people most affected by these issues trying to solve their own issues because the people that have this responsibility are doing an inadequate job. And if you're doing an inadequate job, you're not doing your job. And if you're not doing your job, then you are not working for us. And if you're not working for us, you're actively then working against us because during this pandemic, people died. These funeral homes, when I would make sure to check in on folks, check in on the churches, they're like, we don't even have supply. We don't have the capacity to have as many funerals as we can in this church right now. So I want you to feel that sense. What do? We did everything. And I'm not here to tell you a sad story. I don't know if I'm here to tell a sad story. I'm here to tell a good story. So then we looked at Chicago. Chicago is a beautiful city. First of all, I got to give credit. Chicago is a beautiful city because of the black folks that made it a beautiful city and the culture we have from black folks. Anybody who wants to argue that, please, first things up, house music. Y'all want to talk about house music? Talk about how great Chicago is. I'm going to say that right now. But Chicago is an amazing city for the people because it's been people fighting in Chicago for the longest. People resisting, right? We talk about the 1930s racist housing practices. There's people organizing against it to make sure that people can have housing in different ways. When it came to people's evictions, community members stood together, not during this pandemic, but during the 1980s, when there was evictions in Chicago in the South Side, people would literally organize to fight cops to make sure people weren't evicted. When their lights were turned off and their plumbing was turned off, then they would have the local plumber come on and turn back the water, local electrician, turn back the electricity. That's what community is. People, we have differences and we have different experiences in life, but our unity, there is unity in our struggle because I am suffering, you are suffering, and if I say I love you, I have to fight for you. And people ask, and that's what I'm gonna get into, people ask, like, why did you go on a hunger strike? We had nothing. We had nothing. Every single time, this is the point I'm saying, is that when it comes to our community members, we have the highest respiratory issues, and we're trying to make sure we survive during a pandemic. And you're questioning me why I'm doing a hunger strike, but you're not questioning why I have to be wearing masks and I have respiratory issues and making sure my community members are safe. My brother was 5 years old when he had to wear a mask to go to sleep every night because he couldn't breathe at night. And my brother looked at me when he was young, and he's like, why are the resources we need the most not in our areas? Why are they in areas where they're not used the most? And that's a different question for another day. But that's a question that can be asked throughout Chicago. And even my brother, once we talked about a hunger strike, because there was victories. We look at the hunger strike that Jeanette Taylor was involved in. We look at the hunger strike from Little Village in 2001. We look at these practices that folks did, and we looked at each other in a Zoom call and said, are we going to be doing this? Are we going to risk our lives? And when you think of your family, when you think of your friends, when you think of somebody coming to your house and wanting to harm your family, you're going to do every single thing you can to make sure they're okay. When we think about this, I also think about the 30-year life expectancy gap between North Side and South Siders. That's crazy. 30 years. Think about that. Think about what you can do with one extra year of life. 2. Think about literally having 6 more months. But 30 years. And we went in this room and we got a presentation from Jeanette Taylor about how she went with her experience. And she said, hey, I believe in this. I believe in what you're doing is right. I believe what you're doing is righteous, and I'm here. So myself, Chuck Stark and Brianna Bertacci said we're going to be the first ones to start this hunger strike for 30 days. And I'm here telling you because we ended up winning, but nobody should be having to do that. The southeast side with General Iron is not the only fight. But so my question is, we're not going to fast forward. The hunger strike itself is very traumatic. If you have any questions about it, we can ask there in the Q&A if you like, but we'll fast forward. We ended the hunger strike after 30 days. And then there's federal intervention from the federal EPA, from Michael Regan saying, hey, I recommend you go through a cumulative impact study, look at the overall environmental burden. It was a deja vu with the town hall meetings. They're asking the same questions. We're scared. It's February of 2022 now. And I really bad tonsils. I had to get them removed. It was February 18th. I'm never going to forget the day. I'm scheduled for surgery. And the day before, everybody's organizing. Everybody's like, look, we need to make sure we hold the city accountable if they allow this permit to exist. And I'm texting all the big organizations in Chicago, hey, get ready for City Hall. Get ready for City Hall. Hey, like, we need you to be at City Hall. And everybody's asking, what are you going to do, Oscar? I'm like, I have to get surgery. I can't do much. So I'm just going to talk to everybody as much as I can. And February 18th, I'm in scrubs. I'm with my dad. My dad's like, how you feeling? I'm like, I don't know. And I go into surgery, and I get out, and the doctor's like, yo, you got huge tonsils. You got the biggest ones I've ever seen. Like, do you want to see them? In my head, I'm thinking about General Iron. I'm like, no. And my dad's like, oh, he wants to see them. And I'm like, yo, what the hell's going on? And I think that's the funniest part. And Carlos, me and my friend Carlos Enrique still talk about this. I get a text from my phone, and I hear beep, 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 and it says denial. The permit's denied, and I'm like off drugs, and I'm like trying to text. My dad's trying to shove the tonsils in my face, and I'm like texting Carlos. I'm like, hey, like, is it true? Is it denied? And he's like, Oscar, go back to rest. We won. We'll celebrate later. And
all right.
But there's questions from this, right? I'm not here to tell you this sad story. I'm here to tell you a story of inspiration because, look, what we experience is fucking traumatic. And these are experiences every single day. General Iron is not the only fight that we're experiencing. We're experiencing violence. We're experiencing violence of food deserts. Like, all of you, if you can, I want you to think about not knowing where you're going to get your food. Think about not having a transportation to get to your food. Our community, our transportation sucks. If anybody takes CTA, we know CTA sucks. I'm not trying to talk bad about CTA, anything publicly yet, but we need to make sure it's for people. But these are the violences we're up against every single day. So it's about, what does bravery even mean? Bravery comes from oppression, and we won. But what does it mean? What does it mean? Do we have to go on hunger strikes to win these victories? Do we have to get 500 people to say no to a polluter? Like, what does it take to be able to say, our representative, if Lori Lightfoot from the beginning said, no, I don't want this facility to come into the South Side. Think about that. It could have taken one person. Or even Dr. Awadi going against the mayor saying, hey, you know what? I don't think this is the process for us. Why didn't the director of Chicago, the Department of Chicago Public Health, why didn't she herself recommend a cumulative impact study where it took in consideration all the burdens we're going through? Right? What does it mean to have true leadership? And for anybody to say, oh, General Iron is a way for people to learn what it takes to really stop something, it is not. We mobilized, but how much did it take? And I need folks to represent what we're saying by this is saying we need true leadership to be able to stand aside against status quo. We were in a call with a politician that said, hey, I can't do more and I have to stay in my lane, but you do your job. And I was like, my job is not to go on a hunger strike. My job is not to be arrested at protest. My job is to be making sure my family is okay. But my job is not the responsibility that you have in DC or at the state level or the local level. It is not our job. So that's our story. Our story is to know, first and foremost, and this is going to sound very off topic, but first, like, there is joy. There's joy in the southeast side. There's joy in Outgale Gardens. There's joy in the east side. There is so much joy, and that's what we're fighting for. There is life. Anywhere where you see community members trying to hustle and trying to grind, it's because they see how much their life is worth. And that's our message throughout the campaign of Stop Gender Irony, is that we are deserving of not being a sacrifice zone for the city of Chicago. We're deserving of clean jobs. We're deserving of funding to our education. We're deserving. We have to look at the gaps between, it's not the same story, right? It's not saying the north side isn't deserving. It's saying the south side is just as deserving as the north side.
Oh, yeah.
So that's what we're here to say. We're here fighting. I mean, we're here fighting.
Thank you, Oscar. Thank you, Oscar. Oscar, we really appreciate your sacrifice and the pain that you went through in the hunger strike. And I think many of us commit ourselves, maybe all of us, to preventing for that need to happen.
Yeah.
I'd like to open it up in the time we have remaining to questions and dialogue from the audience. And
Oh, my bad, Jim. Can I say something too?
oh yeah, please.
Because we see a lack of leadership, because of that, I'm also running for 10th Ward Alderperson. So if you want to support, let us know.
What's that?
Oh, you didn't hear us?
I didn't.
Oh, Jim didn't hear me. Oh, Jim, I'm running for 10th Ward Alderperson because we need true leadership in the 10th Ward.
Thank you.
I love it.
Should I use this mic for the Q&A? No, we have. Yeah, we use this one. So, like members of the audience, yes, please. Could you use that microphone right in the right next to you there, please, in the aisle. Thank you.
Hey.
Hello.
Hello. First, my name is Billy Coleman. I wanted to say thank you for your bravery and your sustainability and your just willingness to show up for people. It's very inspiring. I wanted to let you know that I'm here representing North Chicago, Illinois, 60064. There's a misunderstanding about poverty in the northern suburbs. We are right next to Lake Forest, Illinois, which is one of the richest cities in Illinois, maybe in the country. We are facing similar pollution issues, so I'm here to learn from you, to stand in solidarity with you, and to glean whatever lessons I can learn about organizing. There is a huge problem of learned helplessness in Lake County, in North Chicago, Illinois. We are currently being exploited by Abbott Labs, AbbVie, as well as the U.S. Navy and other dominating organizations and corporations that are taking over. My dad died from COVID when it first happened, and it was really eye-opening because a part of learned helplessness is a rejection of environmental issues and thinking that it doesn't really impact me. That's something that other people should be worrying about. I grew up across the street from Abbott Labs, and once a week, there will always be a funny smell. There will always be this really weird smell that will hurt your chest. And parents start to teach their children that that's just what happens. Every Tuesday, it just hurts to breathe. And I think people don't realize that this is happening in many places. When COVID hit our entire family, my dad didn't believe in pulse oximeters, and the healthy oxygen is at 95% or better. And by the time we got a pulse oximeter on my dad sitting in our couch, he was at 40%. And so he barely could make it down the stairs. He went right to the hospital, right behind glass, and then right to a machine in Boston. But I just remember how defiant he was because he thought that that was the way breathing felt. You know, I took it upon myself to go to Borneo, to go to the rainforest, to see what it felt like to actually breathe oxygen. And it felt so drastically different that I thought my brain was gonna explode. It felt so good. And I think about all the children, the moms, the dads, the aunts, the uncles, who go through these experiences and they think it's normal. They think it's supposed to be like that. They think that lead is supposed to chip on the window and maybe a baby might eat it or not, or, you know, they just really think it's normal. So I just want to say thank you to you and your ancestors and all the people who supported you. In the northern suburbs, a lot of people don't know how to organize. They don't have a lot of the access to resources or storytelling that may come, but I just want to say we're in solidarity, and I hope that we can continue to collaborate to learn from each other. Thank you.
Very good. I just want to say one part to what you're saying, Willie, is that we have to understand our history to be able to say how much reparations we need. And one of my favorite kind of like quotes is that it took two people to make you, right? It took two parents. For you two parents, it took four grandparents. For your four grandparents, it took 16 great-great-grandparents. And it keeps building and building exponentially, right? So our need of reparations is drastic, right? It is not just with us. It is not just the history now. It's the history before us. But do you know what's important right now? It's that you're alive. And they want to fucking kill us, and we're here alive. And our existence is rebellion. So I want to say I love you, and we appreciate you. We're going to continue talking, all right? So can we keep it back to Willie?
My name is Melissa. I'm from Rush University. And I kind of echo a lot of the things he was talking about in terms of the learned helplessness specifically and kind of mobilizing for even that community. That's one of the bigger struggles that I've had when I'm trying to make changes, because you need that population, you need the community. Otherwise, you're going to have a really hard time getting traction or going anywhere, or creating enough of the scene to be seen and heard. So it sounds like you guys are incredibly effective. Do you have any top tricks on combating that learned helplessness or forming community in areas that may not have that initial strong structure and kind of forming that basis?
Well, for me, I would find somebody else who cares in that same community just like I do. And they might know somebody else that cares just as much as they do. Then you just keep continuing, because for every one person you know, it's at least one person that they know that care. You know, you never step into this fight knowing who's going to support you. You don't know how to even get the support yourself. You just believe in something and you keep going. And that's going to get you all the support you need.
Yeah, that's real. To kind of go back, I always thought, I worked with youth, and I love youth because I'm going to say youth are the ones going to save on capitalism, because they are not tied to capitalism. Their ideals are beyond that. But what I will say is when they're like, Oscar, I want to be like you. I'm like, no, the story's not to be like me. You have to be authentic to your character, organize how you want. I'm like, and I break down organizing very easy. I'm like, organizing is in 4 steps. Is 1, what issue do you see? 2, what is the issue that people will see just like you? What is your solution towards it? And then how do we implement it? I know it sounds very superficial and simple, but literally what Beria is saying is people are facing this. The way that folks first started organizing the Southeast side is by the moms saying, hey, my child has respiratory issues. I don't have it. Their father doesn't have it. Does your child have respiratory issues too? And they're like, oh yeah, that's very weird. Why is that? And then they're like, okay, so it's not always about asking, and this is with any type of organizing, it's not about it's not about knowing the right answers to it. It's about asking the right questions. And it's about making sure your intention is coming from a place that you're able to say, I'm sorry if the impact is wrong. So it always comes out. So my advice is talk to folks, talk to churches. I think they're changing, but there's still really great power of organizing. So churches, if there's no organizations, consider making an organization, or talk to other folks about learning to organize. Midwest, I forgot the name. I think
Academy?
Midwest Academy is phenomenal about learning the short-term and long-term goals. But it's literally organizing. if we strip it from all the formalities and make it the most casual thing, it's having a conversation of like who's being affected, how do we elevate these stories, and how do we reach the demand?
Yeah.
And I hope that helps.
If I might, just maybe 30 seconds. I would say from my perspective, having worked inside of Cook County Department of Public Health, and even now outside and retired in an unfunded non-for-profit, you will, I made a phone call to Olga Bautista in the morning, a cold call basically, and she picked up the phone, and I said, I just learned about your struggle, here's who we are, is there a way that we can talk, is there a way we could be helpful to your struggle? And it's just taking a shot like that sometimes. And she said yes, and so we talked, and so that's always something that can be done, is to reach out to people. In addition, I would say within a health department or bureaucracy or a non-for-profit, is echoing what Beria said, is to find like-minded people and get support for your ideas. Say your ideas when you feel that it's right, and then you never know, you're going to attract people to your ideas. So raise that flag, and I would say a support network is really important.
Awesome. Thank you all. Hey, you guys are awesome. Oh, my name is Margarita Reina. I'm senior epidemiologist at the Chicago Department of Public Health. I've been knowing actually Jim for almost 30 years. I've been at the health department for 23 years. And I mean, the work that you do, I'm a community organizer, then became an epidemiologist. And it's kind of a hard struggle, like Jim, to do this work in a meaningful way. But just like Jim, you connect with the people. And I just want to let you all know that I'm here as an epidemiologist. I do a lot of data literacy training to community stakeholders, community health workers in Spanish, and just let me know if I can be of assistance. And I'm so proud of the work that you all are doing, so thank you. And thank you for DePaul for bringing you guys all out here to tell the story. That's so inspirational.
Thank you, Patricia. Thank you so much.
Celeste Torres, I'm up in Waukegan, Illinois, and Oscar, you mentioned joy, and that, this work, there needs to be joy within this, so I'd love to hear from all three of you guys, like, we're here, it's public health, equity, social justice, so what brings you joy? What do you do to have joy in your life?
I want to hear from Beria first.
Yeah, I want to hear from me. I knew it. So I just wake up happy. I try not to, it's a lot of sad stuff that we could just dwell in. And of course, you dwell in that, you become that. I don't become that. I wake up with a smile even when the day is bad. And I just keep that with me. I mean, that works for me. Just still remain humble. Still keep your joy and don't let nobody steal it. Even when stuff is going bad, I am still the happiest person. I don't even know. It's a gift from God. I mean, I just gotta give it to God.
You have joy?
I have a lot of joy. I'm so lucky. It's been one of the most joyful and thrilling experiences in the last, 14 months or so. Especially that Victory Day, I want to say February 18th of this year. I was shocked, I was stunned, I couldn't believe it. None of us expected to win. So I think my joy, but even if we would not have won that fight, I still had joy working with other people and learning and practicing, trying to fulfill ideas, working together with other people, especially being with other people. I think it's very creative. It's like you never know what's going to happen. I couldn't believe it. So that sense of possibility gives me joy. I love to read. Since I've been retired, I can read whenever I want, whenever I want. And I like to express myself. You could see I talked a little too long. I have so many slides. And there's so much to explore, constantly finding out. and the history. It's so powerful. I'm so lucky to have so many friends and family. So all of that gives me joy together at this particular moment.
And I want to add too, if y'all guys want to find me, y'all can look me up on pcrshot.org. Y'all gonna see my picture like this. Again, I'm Beria. I bring the joy to the office. I could be the guy in trouble for something, and I'ma still make a joke out of it. Okay. So I'm the most jovial person. I think they come in to work just to see what I'm gonna do next. Cause it's something. I don't even know what I'm gonna do, but guaranteed you it's something. So just look me up, and if it's ways I can help, again, pcrshot.org. I'm Beria Hampton. Any of the staff involved in that office will be happy to help. I'm always the person that get everybody directed to, or maybe I got the most joy, or no matter what, I'm just gonna keep it real. I'm gonna keep it like that. And they love it just like that. Crazy and all. So that's me, you guys. So look me up, and I'll help with anything I can help with, point out any resources that I can help you guys with, and do the same for me, because at the same time, I still need resources to continue doing the work that I do too. And when you win one fight, here come another one. So this is just one victory, but watch another one come right behind, because this ain't the only issue.
No, it's not. Before I'm gonna finish up, I just have to say Jim cut his presentation in half just to let y'all know. Barry, I love you.
Thank you. I love you too.
It's hard to find joy in these moments. 14 months, I'm gonna question. That's kind of hard, bro. But that's the way we want to be. And my only point I want to add is that I've been saying this when I was younger. I think you might find this interview back like in 2018. But I said like I find joy knowing my joy is a middle finger to the oppressor, right? Like it's saying, fuck you. I'm going to make sure I can acknowledge all the racism, all the capitalism, because every system is perfectly designed to do what it does. Every system is making sure we are silenced. Every system is made sure that it is worked against us. And we just see it happen every day. But when we delay it, when we stop it, it's like, damn, this is a system of centuries. This is a system that the majority wants to exist. This is a system that doesn't acknowledge me or the existence of many folks here. And if I can smile and say, hey, I know you're mad, I'm going to have a great day.
And I can give you guys proof that my life not perfect. I'm a mother of 9. And I stay happy all day. You know having 9 kids don't make you that happy. But I'm a joyful person, and I think a lot of my joy comes from other people's joy. Seeing you guys happy. So, just point that out.
That's a nice way to end. Thank you.
Thank you.